Third Park Hospital is a world-class institution. It has world-class trainers who really understand what they need to do and what they need to teach you.
I would say it's a state-of-the-art facility, very enhanced modern features. I think even the ultrasound machine itself is different from what I've seen. So for that reason, I've seen what possibilities are out here in regards to ultrasound and also diagnostics when it comes to imaging in obstetrics and gynecology.
Today, we are conducting a workshop on advanced ultrasound in infertility.
The role of ultrasound in infertility is basically to help us provide a bit more information on all our patients. We can do better investigations for the patients and we're able to have better outcomes.
Ultrasound has a huge potential, not only in the diagnosis of the patients who are presenting with infertility, for the monitoring, for the management, and it can absolutely change the outcome of the treatment. A bit advanced techniques where people are still probably quite hesitant to use it, but they are not that difficult is what I want to show them here and remove this hesitation so that they can start using this technology for the betterment of the patients. So it's for this reason that it's very essential that you understand the machine fully, and not only understand the machine fully, you must also identify them and use the best points of the machine, the best qualities of the machine to give you a more positive results.
Firstly, we're really blessed to have Dr. Sonal Panchal be here with us. She is such a pioneer with regards to ultrasound and infertility in India, and the fact that she's able to come here to Kenya and help out East African doctors is incredible. So Dr. Sonal has literally just helped us become a lot better as ultrasonographers, as gynecologists, and she's taught us different ways and mechanisms of identifying different problems, which I think is incredible for all of us. I've always been passionate about women's health, and when I heard about the potential of ultrasound technology to improve infertility diagnosis and treatment, I became intrigued. So I decided to attend because I wanted to gain knowledge in new skills to make a difference in the lives of people who are struggling with infertility.
There is increased need for ultrasound intervention and the need to always check basic ultrasound features in regards to development of the baby, or if there's any sort of maternity-related complication that you would need to confirm on ultrasound. So this would better enhance my skills as a doctor.
I would like to improve patient care and outcomes for patients with infertility by gaining more knowledge in how to manage the patients and how to investigate patients better using ultrasonography, which has been shown to be less time consuming, less tedious, and also less costly to the patient with better outcomes.
For male infertility, it's more important, especially in the assessment of the testis. The ultrasound will tell us more in detail of what is inside the testis. What are any other things that we can correct that can cause obstruction of the small tubes that conduct as a conduit for the sperms as they travel. And therefore, ultrasound contributes a lot in the management of infertility in both male and female.
For the unicornuate uterus, you all know that if you are seeing the hyperechoic central line, it is a functional endometrial cavity, which may always not be present. Thank you.
Big applause to Dr. Panchal.
Thank you very much.
We have been doing trainings over the last year that we've been open, and our main goal is to make sure that every clinician that walks through here, every patient that is admitted here has the best opportunity, the best research-based theories, the best research-based hospitality here, medical care. That's what we want. And we also want to increase the medical care and the medical information that there is out there in the world, and especially for East Africa.
The impact that this training will help in my career is better diagnostics, and having learned so much from Dr. Sonal and the team that organized this training, there's been so much knowledge shared and interventions, both practical and theoretical, in regards to the ultrasound features that you look for during obstetric scans, as well as other other related topics. And for that reason, it would be able to help me see and understand my patients better, and therefore make better informed decisions in regards to medicine.
My advice to everyone, to all the young students, the older generation as well, is that you must train yourselves and retrain yourselves, keep yourselves up to date with training, because it only makes it fun, it makes it more interactive, and it improves your patient outcomes, and you also enjoy what you practice because you know what you're doing is current practice.
Learning is a continuous process, it never stops. So welcome to Third Park.
Asante sana Third Park Hospital.